Hi, everyone, and welcome to the 2024 Global P.A.D. Impact Awards. In this episode, we have the pleasure of celebrating remarkable achievements in the fight against peripheral artery disease. One of our most inspiring honors is the Best P.A.D. Walking Campaign Award, which recognizes a campaign that has truly made a difference. Now, this award highlights a campaign that not only raises awareness about PAD and the benefits of walking, but also engages a diverse audience through innovative and creative strategies. The winning campaign, the Vascular Walking Challenge, demonstrated exceptional success in reaching a wide range of participants, from PAD patients and their families to healthcare professionals and the general public. Through effective collaboration and a commitment to long-term impact, this campaign has significantly improved the lives of those affected by PAD. It has truly set new standards for community engagement, inclusivity, and measurable outcomes, ensuring that participants are informed, motivated, and supported in their journey toward better health. Today, we are thrilled to present the Best PAD Walking Campaign Award to the Society for Vascular Surgery Foundation. And here to accept the award is Catherine Lampe. Catherine, congratulations to you and your entire team for such an amazing accomplishment.
Thank you so much, Kim. We're so honored and to be your partner for the past 2 years, now going on our third walking challenge together. I think this has really been an innovative walk because of the partnerships we have had, the feedback we've gotten, and the connection we've built to our community.
Have you gotten any feedback from any of the participants in terms of how much it's motivated them? Maybe it's led to a permanent change in their life.
Yes, so we've definitely heard about lifestyle changes. Even some of our members who are not walking outside of their hospital or when they're at work, making a commitment afterwards to incorporate family and doing this with their children. We've seen members start registering their families, their cousins, their kids. We've heard that, like I said, my mom, who's someone, or I have a few other friends that joined who just did not even know the benefits of walking. And so the numbers we're seeing in our registration, we're trending much above last year. And the first year we've done this, we're seeing higher mile counts. So the folks that are coming in and participating are coming back at higher levels. And then our newer walkers are logging more miles than newer walkers had year over year. So we're seeing growth in the campaign, growth in participation. And that's what we want to see when we look at the mile counts is what are you doing year over year, which the tool that we're using allows us to look at that, and it's nice.
Every single week has a different day. So you mentioned Monday. What is each day?
So we have My Health Monday, which I said is a fact tip. And then we have Why I Walk Wednesday, which is our weekly sharing of a story. So it's either a patient, a member, a family member, an SVS staff, someone who's coming on and talking about why they're walking. So we hear that folks are walking, to create a healthy lifestyle for their children. They're walking for part of their walk therapy program. We are hearing why folks are part of our campaign. Then we do our Victory Lap Friday, which is our big celebration of our weekly top walkers, weekly winners, and weekly teams. So we've created, using our Charity Footprints platform, you can walk by yourself, you can walk with your friends, you can walk with your hospital, and we celebrate the teams through their engagement. So you can win the challenge, not just by raising money, but it's really about walking. So we want to see you getting out there. And so there's a lot of friendly competition amongst our walkers, which we try to highlight. And now we've created a new walking award. We have a wonderful woman named Concepcion, who is a third-year walker. She is in her mid-60s. She lives in Mexico City. She's the mother of one of our surgeon members. And she's won the challenge every year. No one can keep up with her. So we've had to create a legacy walking award for her so we can make it fair to the rest of our walkers, but still celebrate everything that she's doing. So it's really just built, every engagement tool we have is built on participation and what's going to keep folks coming back.
And are there any standouts? I mean, aside from Concepcion, are there any other standouts? Because we've already gone a week now into the program. So I'm curious if anyone is any standout, anyone, taking exceptional strides.
What we love to see is on the SVS staff side and on the non-surgeon participation who's coming through. And so we're always looking to see if we don't recognize a name, who are they? And when folks are putting photos in our our scrapbook. So I can't think of another individual, but generally we do see individuals commenting, I'm walking more, I'm trying this. We see an uptick in the daily life. And so it is just a fun way to push yourself to make a little bit of a difference. There's always the motivation for a prize. We give away, t-shirts, pins, top walker gets a gift. And so there is a motivation there, but it's really just about competing with yourself. And that's what we love to. It's about you and what you're doing.
The awards and all that stuff is really cool, but I have to realize this is about life and limb. Really, it is about my life and keeping my legs and the importance of that. And we do struggle trying to get people. We have people walking 10,000 steps, and then other people will say, well, I'm not going to do it because I can only walk 100 steps. But trying to get them to understand the importance of 100 steps is the same for them as people who can walk 10,000 steps now, and getting them off the couch and involved, engaged. And we've been hearing that a lot this month about exercise. Exercise is exercise, period. Get off the couch. This is about my legs and about my life today, and the importance of, if I can only walk to the mailbox, at least I'm going to walk to the mailbox. If on those days I don't feel like I can walk to the mailbox, I have 10 steps in this trailer. I can go back and forth while I'm watching TV. So I'm not sitting on the couch. So it's buy you some paper plates, put some paper plates on the floor, and just move your feet. Exercise, do something, get out and get involved. We're not dead yet. P.A.D. is not the end of it. We have to remember that. And it's getting out and walking, whatever that is.
As great as it is to hear our surgeon members talk about why they're walking, like Douglas, exactly what you said, like this is life or limb, and there's so much that you are doing. And it's so inspirational to hear. And that's why we're doing the challenge and the campaigns.
Walking is important to me because I have to build the collaterals in my legs. That's what is the number one thing in my ability right now to stay engaged for my patient care. To be able to get the word out and give that hope, courage, and strength to those who can't walk 10,000 miles, 10,000 steps, to let those who walk in 10,000 steps, give me another step. If you can only walk 10 steps a day, give me another step. Join the collateral nation. That's where we build those collaterals. So trying to get people motivated, yes. And we all have good days and bad days. So it is that point where, 30 days is a long time to keep people going all the time. Kim and I know that because we have that with our walking group too, trying to keep people motivated over a period of time. Through welcome to life, welcome to living the journey and adventure of life, and the importance of saving life and limb is walk.
And that's what we call it. And Catherine, we call it our collateral nation. And it's so funny. I get calls from doctors, several of them over the last couple of years. I had to talk to the person that has my patient asking me about collaterals. We had never had any patient come to us and talk about collateral vessels before. And it is, for one of the doctors, he said it's actually changed his conversation with his patients, recognizing that he has been doing a disservice to his patients, just telling them, oh, go walk, without explaining the mechanism of action by which walking effectively can grow a collateral network of vessels. And so through our network, every single day, I keep getting texts from these patients or posts or comments where patients have said, since finding your organization and joining your group and your walking program, I am so thankful I canceled my procedure.
Wow.
I no longer need one. And that is music to our ears. We understand that for people, procedures are needed for a set of patients, right? And it's a big part of our education program to help the patients in choosing the best doctor for their presentation of disease and empowering them with the right questions to ask the doctor to ensure the least amount of trauma to their vessels, the less is more approach, and really making sure that there's a clear understanding between the patient and the doctor that there are two reasons to have a procedure. Number one, primarily to heal a wound, but number two, it's to get me just that much more blood flow so that I can get some symptom relief, so that I can get on my feet to grow collateral vessels. So when that procedure fails, when that stent goes down, when that bypass goes down, whatever time frame it is, that I'm going to have built my own natural bypasses and will not need a revolving door of treatments, right? But the biggest part, what our primary focus is that we gotta prevent them. We've got to get those people in the intermittent claudication stage and the lifestyle limiting stage even to push through that pain, to understand it's not like when we were a kid and we get a muscle cramp due to spasms or, nutrient deficiencies or whatever. Like, this is a blood flow issue. So while then you worried about an injury when you push through the pain, not now. When you know you have a circulation issue and your cramping is directly caused by the lack of circulation, you've got to push through that pain, because it's when your body is feeling that pain and you are pushing through it, that's what triggers the collateral network of vessels to start kicking in, to start rerouting that blood flow. And so when you experience that pain, take another step, take another step, take another step. And so when you have a program like yours, where you are giving us an additional month with additional focus and a challenge that can make it more fun to do so, the challenge being a distraction, in a sense, to the pain that they're in, the dog as well being the distraction to their pain, we're helping them just go a little bit further, grow a little bit more. And so for that, we thank you so much for all you're doing. And what I love, Catherine, is that, over the course of the last few years, as your team has grown this challenge, that we've seen, I think you're the only grand walking challenge because of your willingness to collaborate with others. It's where some organizations may say, we want to own this, it's all ours. What I love about you and your entire team and your mission and your intention is collaboration. It's truly creating a team. I think Hillary Clinton was one of the first to say it so long ago, but it takes a village, and you are really creating that village and inviting everyone to play a role in the walking challenge that you all have created. And so I really thank you for that. And I really want everyone to acknowledge that, because I think that is really, driven the success and has actually, led to this recognition here through the Global P.A.D. Impact Awards for 2024. The Best Walking Campaign Award goes to the SVS Foundation and Catherine's team. So thank you from the bottom of my heart for all you do to help raise awareness for walking as being the best medicine for PAD.
Thank you so much.